Hello, my name is Jasmine Smalls from the University of Louisville. Today I'm going to be talking about alarm fatigue in nursing. The first thing that we're going to do, we're going to define the problem. Second thing we're going to do, we're going to explain the PICOT, as in P-I-C-O-T, in the search process. The third thing we're going to do is we're going to briefly discuss the articles. Then we're going to discuss the synthesis, and finally, the conclusion. When we look at the problem in regards to alarm fatigue, the main problem is sensory overload in nurses. Due to sensory overload, nurses may ignore or not hear unconsciously an alarm going off that can be really critical or fatal to a patient. When we look at the population we're talking about nurses. When we discuss the intervention, we're talking about education and training. When we are talking about comparison, as in no education, no training. Look at the outcome of the goal is to reduce alarm fatigue in nursing. And the time period is over a period of 3 months. The keywords used in this are alarm fatigue, alarm use education, and nurse alarm management. The first article uses CEASE, which stands for Communication, Electroid Appropriateness, Setup, and Education. This mode of alarm monitoring was used to determine the impact of education in reducing alarm fatigue using a non-randomized quasi-experimental design with a pre- and post-implementation approach but without control. It proved to be successful in the reduction of auditory alarms and nuisance alarms with no adverse side effects, which led to them implementing this CEASE bundle even more. The second article focused on the training effectiveness. It used comparison and pre and post intervention interpretation from alarm signal data for the monitor recording devices themselves. In addition, this article used beliefs that led to intentions to change nurses' behavior. Although did not have any adverse side effects, it had many limitations, including but not limited to questionnaires not being validated, group contamination, and single site studies. We look at both articles had positive outcomes. However, both articles failed to discuss the long-term effects of alarm education on alarm fatigue. The first article does not explain the need for a longer duration of priority high alarms, and the second article does not provide a true association between the intervention and the outcome because of the lack of method and limitations. Although both these articles have their limitations, it does not negate the fact that both use of education and training had a significant reduction in alarm fatigue in nurses, leading to providing better care for their patients. In conclusion, alarm fatigue is a problem that should be taken seriously. It impacts the nurse's ability to safely care for the patient, provide care, and it is very necessary for nurses to be educated on training on alarms and their uses, their modifications, anything that regards alarms to help promote patient care. In both articles, the intervention effectiveness through education was positive, even with their limitations.